G'day world, Macaroon coming to you live from the Sunshine Coast on a beautiful sunny day with birds chirping in the background. We're here at the Innovation Centre and we're here with Vidya, who has just pitched at the secret pitch.
Private pitch, I would say.
Private pitch. And you just did a pitch to Ian Mason from Virgin Startup.
Yes.
and a few other people around the table. Tell us a little bit about what you pitched and we'll go from there.
Yep, so primarily I pitched for my company called Net Health.
Yep.
So we are into the health
Yep.
tech space. I pitched for Ian Mason and we had Mark Pattenberg, CEO of IC.
Yep.
And showed them about my platform, spoke about my company, what it does, where it all started from, and where to from here.
Okay, so tell us a little bit about what your company is and how did that start?
Yeah, sure. So my company is called Net Health.
Yeah.
So we are into health tech space, creating a telemonitoring software platform. So we want to help people prevent from being hospitalized. So where it all started was my father has diabetes and he lost his left eye vision 2 years back, and he was on the verge of being hospitalized, but he used Net Health data, which is my platform as it's called, and with the monitoring he got back his eyesight without actually going to hospital.
Wow. So just from monitoring his...
Yeah.
What is your platform monitoring to help point those things out?
So the platform, it collects the information like blood glucose or blood sugar level, blood pressure, heart rate. So once it gets all that information, there are these health professionals who look into that data, and they provide guidance. They coach the patients so that they stick to their regime. So with my father's case, the doctors got to know that after he took his diabetes medication, actually the medication was not working. His body got immune, so pretty much his sugars were rising every day because the medication wasn't working.
Wow.
That's where it all started, yeah.
Yeah. So by monitoring those levels, the doctors can monitor the key values and prescribe the right medication.
Correct. Yeah, absolutely.
To prevent those things from happening.
Yes.
Great. So So you just did the pitch. 5 minutes pitch.
Yes.
What were some of the key takeaways that you got out of that, and what's some of the feedback that you're going to apply to your startup?
Yeah, primarily it was what Ian mentioned about the focus in the market. He emphasized that there is a requirement for a platform like Net Health data, and definitely focusing on the target market whom we want to go out first, because there's a lot of noise and a lot of people want to get into health tech space, but as soon as you target the market that you want, pretty much you can scale very quickly.
Yep.
And he spoke about the scalability, how if we think currently we have X number of customers, if we move on to 10x customers, how are we going to capitalize, or how are we going to sustain? So those were the key points that he mentioned, which was fantastic.
Yeah. So where are you at now, and what's your plans for the future?
Yeah. So currently we are in the aged care sector. We have more than 100 customers who are using our platform, and our aim is to go to the next level, add 2 zeros to that probably, and our target market would be coming back to the diabetes clinic or the lifestyle conditions clinics, diabetes, heart problem clinics, and outpatients clinic. That's where our market is, and in the next couple of years we are looking at going to all those clinics around Australia and also in hospitals around Queensland, New South Wales, Victoria.
Okay, great. So are you currently Queensland only?
Yeah, currently it is.
And you're planning on expanding nationally?
Correct. Yes.
Great. And so you mentioned in your pitch that you're aligning yourselves as the sort of the in-between Apple and the GPs.
Yes.
So you're not necessarily competing, you're more collaborating and using their hardware to integrate with your software.
Correct.
To transfer that data to those GPs?
So that's the reason we are in market. We want to create that integrated care platform. So we sit in between these apples who invest so much of money. So why not make use of that technology? So take that technology, we sit in between, do our smarts, and we integrate with the doctors. So giving them the complete information, or not what information would be required for them.
Yeah. And so could you give us a bit of example, or you mentioned some case studies about someone not losing their toe.
Yes.
What's some cool stories that you've that your product has helped people?
So that was one of our major ones, which is kind of you feel happy about it. Not that they got to that stage, but not to the fact that it saved the toe. So those users' exact words they say is net health data help them not getting their toe amputated, so prevent it from getting amputated. So that's the main focus. And the other aspects is one of the person who is diabetic. There are these conditions where in the middle of the night the diabetes level drops. So this information wherein it could predict what's in the next 1 day or 2 days, it gave him an idea of what was coming, so he could take the preventative action before he went to bed. And those are some of the interesting ones wherein he could have passed out pretty much while he was asleep. So that's interesting.
So you not only monitoring while they're awake, while they're asleep, when they don't notice those slight changes in mood and
sleep patterns.
Patterns. So do you have some sort of AI built into your platform where it's continuously learning and then adapting and alerting those GPs about these different things?
So we have partnered with one other company. So they have the AI learning, which takes in the existing information, what the patient has given them in terms of blood, the usual ones, the vital clinical information. And there's continuous learning based on the demographic, where they're coming from and what's their age, all those patterns, and it predicts what's in store for them. So if they're good to have a chocolate cake in the next 1 hour.
So it lets them know that if they're allowed to have cake or not.
Let's put it that way.
And so you're keeping an eye on your dad as well for when he
he hates it, but I love it.
You can tell him off.
What did you eat today, Dad? No, just joking.
Awesome. And so is there any way for people out there to find your platform, and what's the best way to reach out if they can help in any way?
Absolutely. So if they want to reach out to us, the best option is to go to our website, which is www.net-health.com.au, and they can send an email to us, or they can call us on 1300-433-896. So, or they can write to me on enquiry@net-health.com.au.
Awesome. And we'll put some links to your site there for you. So to finish it off, why do you think it's important to do these types of events on the coast? And supporting startups like yourself through the Script initiative. How are you involved in the ecosystem today?
So being a member of Innovation Center has given me such a big opening and big platform to present to these people. And being a startup, getting access to such people can be quite hard, and getting those right people, the decision makers, can be quite challenging for a startup. But being in Sunshine Coast and being part of Innovation Center has helped me get that right contact through networks, through warm lead-ups and things like that. That's actually emphasized us to go further, not to give up, but to move forward.
That's great. So we'll be back more, coming to you live from the Sunshine Coast for the next 2 days. We're here at the Innovation Centre till 3, and then I think Steve Baxter's coming down from Brizzy, or coming up from Brizzy. So we'll be back, coming to you live. Thanks for joining us.
Thank you so much for having me.
Wish you all the best, and we'll make sure to put some links down in the description to find you. Check her out, guys. Be back for more. See ya.